Nursing absolutely has a place, not only in nursing informatics, but in health informatics, in clinical informatics, in every area. Nurses in Australia, there's 350,000 registered nurses in Australia. Nurses in the acute sector make up between 55 and 70% of every workforce, and in aged care it would be in excess of 90%. So if health in general is naive to think that nurses shouldn't be part of the decision making, part of the strategy, part of the architecture and design, then they're naive and we're naive as nurses if we're not trying to get at the table and lead these initiatives. Do we do that? Not always. We tend to be led, and that's the frustration as a nursing leader. So my recommendation would be that to make it seamless at the end of the design and solution phase, we need to get the people who are using the system, designing the system, and at the discussion point. And what I've found in the past is that what will happen is something that will be delivered or will be implemented, will be purchased, and then nursing then has to pick up the point of implementation and make the changes. And what you'll find is the frustrations, the lack of clinician understanding in the design, and then of course usually it adds work for nurses. Double handling, education, if there's non-compliance, there's a lot of money spent in these systems, and they're not really providing the time saving to return to care that the nursing workforce should be seeing for a return on investment. You don't always see the patient satisfaction survey results that you would like as well. And a good example of that would be point of care delivery, where we're moving very quickly, but where we've got these workstations at the end of the care, and in some large health services throughout the country, their patient satisfaction data actually reduced, because what they said is, well, the nurses are down there looking at the computers and not actually asking us, so they're going through tapping and the connection with the patient. So somewhere in that design, if a portable device had been considered that was small and didn't take the focus away, which we have now, but millions of dollars have been spent on those solutions. Nursing leaders have to be involved. So you'll have individual nurses. If you look from the perspective, there'll be individual nurses who have an interest and who pursue and even take this as a career pathway. But it shouldn't actually run on parallel tracks, where this is the profession and the operations and the busyness of hospitals and healthcare and service delivery, and then this is an adjunct on the side. And it's still the IT realm. What we actually need to do is combine it. So you will have individual nurses who have found it as an interest and sort out career opportunities or discussions, but generally we need it systemic through the organisation and through the decision making. Your most senior nurses have to have an understanding of informatics. At the most effective level, we could look at our language through nurse-sensitive indicator outcomes. We can actually, through linguistics and an understanding of what we're doing, tie patient care back through health informatics and through all the clinical outcomes that nurses affect. Because there's diagnostic outcomes, there's medical outcomes, but if you look at falls, pressure ulcers, medication management, there's many areas where we have a direct effect on the healthcare dollar, one way or the other. So it has to be at the highest level, because when you're the director of nursing or a chief nurse, you then have the opportunity to delegate and make sure that your nursing workforce is where they need to be. So the duty of care and the onus is on the senior nurses to get themselves, nursing leaders, to get themselves educated. And from the university, because I'm a university professor as well. So we really need to understand what we're doing to influence curriculums and then take that through to the healthcare setting. It's the 21st century. Absolutely. Do they? No. They have to know. People coming through, you can't even get through a university course without using technology, digital data and technology. So they have the skill set. It is becoming consumer driven and even staff driven. So they have a knowledge and a tacit knowledge, an intuitive understanding. What we're not doing is put the language around it. So if I said, oh, tell me what you know about clinical informatics or nursing informatics, people look blankly at me. But if I said, oh, what computers are you using? Then of course they'd be able to talk to it. But there's not consistency in technology, and particularly Australia is a very large country. Some states, New South Wales particularly, is looking at a systems approach, but other states it's organic. So there might be homegrown, there might be shelf. So you could be a student nurse and you could have a few clinical placements and be needing to navigate yourself around several different health informatics systems. It's a massive undertaking when you're worried about learning about the body and the cells and the care delivery, is to then try and work out the systems. I think we've got some really silent, unsung heroes. I think that there's a small, quiet group that perhaps aren't always at the top of the professional national leaders who understand it, get it, speak the language, but I think they operate in their sphere of control quite well. But how are they getting a platform to get the message out, and how do they influence their peers, or do they just focus? So I think that there's some very talented people out there. I think generally the nursing population, if the organisation has invested in technology and digital and data technology, then they're learning. But I don't think they're understanding the why. They're getting the what and the how, but the bigger picture I don't know that they always get the benefit of.